and it has gone up. The number of flu cases in the state of New York, now defined as prevalent in the state. That's a new category. Flu is prevalent here in New York. They are up 25% over 1 week. Hospitalizations are up 30%. Very, very sad to report that there have been 2 pediatric deaths related to flu. So I want to make sure that everyone's reminded to get their flu shots. I had mine a couple of days ago, and it's really important that we keep ourselves and our families safe. But why we're here today, we're continuing to build on our nation-leading work to make mental health and addiction care more accessible to all New Yorkers, regardless of where they live or their socioeconomic status. So we had a chance today to talk to people who are dealing with co-occurring disorders. What does that mean? You can have mental health challenges and have depression and suicidal thoughts, be bipolar, but also have substance abuse challenges, addiction to fentanyl, to opioids, and other addictive materials. So often you have to go to 2 different places. Think about that. You have to go here for your mental health services and then find time in your day, in your life, to then have to go find support for your addictions and to how you can get support and therapy for 2 different co-occurring disorders. We're changing that. That model does not work any longer. You come to a place here like VIP here in the Bronx who are doing an extraordinary job helping people heal completely. And those are the services we're intended here to provide. We also want to make sure that people know that this is a place where we can provide mobile services. We just invested over $200,000 in a unit I toured outside, the mobile medication unit. I talked to the nurse and the individuals involved there. They literally travel to different places. The one out front goes here in the Bronx, goes to Queens, goes to Manhattan. And what they're doing is making sure that they can provide methadone or fentanyl test strips or naloxone to people who won't have to take time out of their lives to get help and get services. They can do it right in the community there where they pull up this van. So that was a $200,000 investment right here. But as I develop my 3rd State of the State address, this is the 3rd year I'm making mental health a high priority. So discussions like I had here today with some of the staff and with some of the patients help me shape and understand where the investments need to go. And this place here treats over 7,000 people a year. It's one of the largest opioid treatment facilities in the state. And again, it's all about that integrated care, that there's not one size fits all, that you come here for one service, you go there for another. It's all under one roof, and that's the power of what we're talking about here. So we're going to continue focusing on this model. We are now increasing, I'm announcing today, the number from 13 places like this, facilities in the state of New York, to 26. And we'll have 1 in each of the regions of the state. 6 will be in New York City, 7 upstate. And this is just one phase of it as well. We'll soon have 39 clinics. This will help serve thousands of New Yorkers, literally tripling the number we've had since I came into office, and making sure that we continue these investments. Also, people walk in the door. They don't have an insurance card. They don't have a doctor. They don't have any kind of coverage. We're investing an additional $11 million to help people overcome this. They can walk in the door and still get services, and insurance will still be paid for. So we want to make sure that people's ability to access service, it's all about access, is not affected by their ability to pay, and that's what this is, why we're talking about. Regardless of where they live, what their socioeconomic status is, their income levels, they all deserve to heal, and that's what we're talking about here today with this announcement of continued funding, more resources, and supporting this model because it has been so successful. Any questions?
So let's start while we have Commissioner Cunningham here from Oasis with any
Commissioner Cunningham, come on.
questions.
Commissioner Cunningham, thank you for your work. Oasis and also the Office of Mental Health is represented here today as well.
So Governor, as I listen at the round table, right, there's some of the people that are receiving these services who actually have healed and they come voluntarily to this place. I imagine it's hard for some of these people to get a job, dealing with these conditions. I wonder this expansion includes some of the folks that receive the service, and maybe they can have employment as well?
Yes, is there an employment element of this as well? But I will say that some of the people talked about it is very disruptive. One individual lost his job because he was using substances on the job and he lost his employment, so he came here for help. And so let's talk about the support we have also for people trying to seek that employment.
Absolutely. So vocational rehabilitation is part of a lot of the substance use treatment programs. So helping people get their jobs, complete their education, that is part of the work. in terms of substance use. And really, a lot of the services are very patient-centered, so that if people do have jobs, they're not necessarily going to then have to come to receive services as frequently.
Any other on-topic questions about addiction, mental health? Or-
I have a question. So with the expansion of these services, which is a great and positive thing, do you feel like there is a target more here in the Bronx or in a specific borough base where you feel like the need is higher?
The need is very high here in the Bronx. We talk about the numbers across the state and identify the areas that are really hot spots. There's a very high number of people who are suffering from opioid disorder. They're addicted to opioid, and fentanyl only exacerbates the situation. So it is a real crisis here in the city, the Bronx in particular, and that's why we're working not just with VIP, which has been so successful, but also with the local elected officials who support funding in Albany to continue this. Going from 13 eventually to 39 of these facilities is transformative. It will save lives. The mobile unit out front, which we're investing in, $1.6 million to add more of them, it will save lives. And we're continuing to find every strategy we can, and we'll be talking about it more in my State of the State address as we unveil our third year of a tireless commitment to ensuring that we invest in mental health services like has never done before.
One more question, Governor. As you have that vision with mental health and make it a priority, when you came to this facility, what impressed you the most that you take that with you and carry that torch?
The round table, I was able to sit with patients who talked about their experience, how their lives have literally been saved. One individual talked about how he's been on this long struggle, mental health, substance abuse, and during the pandemic, and I think what I took away was that the pandemic really threw people back on their heels. It really took them to a dark place. And he talked about how he was considering even throwing himself in front of a bus or a car to end his life because he had hit in such a low. And then he came here. And he has been renewed in life. He feels optimistic about his future. And he was so grateful for the compassion of the therapists and the counselors who dedicate themselves to helping others get through the harshness of life. That's what I took from this. When I heard those stories, how individuals' lives are going to turn out so much better because of the compassion of the people who work at a place like VIP, it is powerful. And that's why I will leave here committed to making sure we have the funding to replicate this model everywhere we can, because people are worth investing in. And I want to thank again everybody at VIP for their extraordinary work here.
All right, let's do a couple off topics.
All right.
Allison?
Thank you, Commissioner.
Governor, can you elaborate more on your meeting with Tom Swazi and just any more information about the special election people need to know?
Well, I wanted to have an opportunity to talk to him directly about what his plan was, how he would run his race, because for me, the most important responsibility we have here in New York State, and I say this as the leader of the Democratic Party in New York, our responsibility is to take back the House of Representatives from the Santos-type Republican Party and to make sure that Hakeem Jeffries is the Speaker. And I wanted to see polling. I want to talk about a strategy. I want to know what his chance of success would be, because we had to put forth the strongest candidate in that district to start bringing back New York State, bringing back more people who are elected who are Democrats. We need that desperately, and who will be partners with President Biden. So that was the context of our conversation, a commitment to run a race that also understands that the opponents are the Republicans in Washington.
How you doing? In regards to the Belmont Stakes being moved to Saratoga, that's great for Saratoga the next 2 years, but the neighborhoods near Belmont Park are obviously going to suffer income-wise. Can you talk about that?
Yes, it is a temporary situation, and we hope to be even further ahead of schedule so we can end it sooner. But it's good we have at least an alternative to, instead of shutting down Belmont completely, that we can take the races elsewhere in the state. But we'll be having job counselors go there and people who can help with job placement opportunities. We have so many unfilled jobs in the state of New York, especially in places surrounding Belmont. I believe if we'll be having an intentional effort. Our Department of Labor will be involved in making sure that they can at least get temporary employment until the track jobs come back. But the Belmont is going to be spectacular, and it's going to create even more jobs when it's all finished, with more amenities and attractions that'll increase the ability for people to be hired there when the renovation is all completed.
All right, got time for about two more, Bernadette and then Rebecca.
Governor, going back to Tom Swazi, does he still hold that you and your husband culture of corruption in Albany. That was one of the criticisms he gave last year during the gubernatorial race.
Well, he apologized for those characterizations, and you can ask him how he feels today. Next.
Just two questions regarding Congress. Just final question about Tom Suozzi. If the meeting hadn't gone well, what was your plan? If he hadn't agreed to your terms, I don't want to call them terms, but if he hadn't agreed to run the kind of campaign that you wanted to see, if he hadn't apologized, what was your plan? And just here in the Bronx, George Latimer, or Westchester rather, just announced against Jamal Bowman. Do you have any thoughts about that Democratic primary?
With respect to your first question, there were other candidates to consider. Everyone knew that I could look at a variety of candidates, and I was looking for someone that I thought could win, but also that was an important conversation to clear the air in one respect. So it was in his interest to make sure the conversation went well. With respect to George Latimer, I've worked with him for many, many years. We have a strong working relationship. I will not be weighing in at this time on any primaries, but I also know how important it is that we get Democrats elected who will go to Washington, represent their districts properly, work hand in hand with the governor to deal with the crises of the day, whether it's mental health, whether it's public safety, the affordability crisis. So I'm looking for strong partners, and I have a very strong relationship with George Latimer, but also I'm not weighing in on a primary.
Thanks,
Thank you, everybody.